What began as a polar expedition has spiraled into a crisis at sea. The Dutch vessel MV Hondius left Argentina with no reported illness. Weeks later, passengers fell sick. A death was reported, and the voyage turned into a deadly outbreak, drifting in isolation. Health officials now link the outbreak to hantavirus, a rare but dangerous infection. 3 are dead and multiple cases detected, with 1 patient in critical care. The virus is usually rodent-borne, but the scale and severity here have triggered global concern.
Hantaviruses are viruses that are carried by some types of rodents. They can cause severe illness in humans, and they can be fatal.
The World Health Organization is now leading the response as fears shift to possible onboard transmission. Close contact spread cannot be ruled out. Raising alarms, this could be more than a typical outbreak and marking a dangerous turning point in the crisis.
Human-to-human transmission is uncommon, though limited spread among close contacts has been observed in some previous outbreaks with one of the viruses, the Andes virus. WHO is working closely with authorities in Cape Verde, the Netherlands, South Africa, Spain, the United Kingdom, and the ship's operators to coordinate actions to ensure the safety and health of all people on board, while also limiting further spread.
The ship now sits stranded off Cape Verde, denied docking over public health fears. Authorities have deployed medical teams and readied isolation zones, turning the vessel into a monitored offshore containment site.
As I said, the hospital has already prepared an area with isolation capacity, should it be necessary, demonstrating our mobilization and response capabilities. A dedicated team has been formed, with doctors, infectious disease specialists, nurses, and laboratory technicians to support patients on board and, if necessary, also on land.
Inside, passengers describe calm but uneasy conditions. Distancing rules are followed and daily briefings continue, but uncertainty lingers after multiple deaths, leaving those on board waiting for answers and evacuation. A global response is now underway. Patients are set for evacuation as the ship prepares to move for investigation and disinfection. But key questions remain on origin and spread, keeping the crisis alive.